Physicians are trained in the art of medicine, science, and healing. We call this the practice of medicine. But healthcare is a business. SMA's Business of Medicine podcast is designed to educate physicians on a wide range of business topics with the purpose of empowering physicians with the business knowledge they need to better enjoy the practice of medicine. This podcast is sponsored by SMA Services. SMA Services is a wholly owned subsidiary of the Southern Medical Association, founded in 1984 to address the business and financial needs of physicians.
Good afternoon, everyone, and welcome back to the Business of Medicine podcast. I'm your special guest host, Dylan Stevenson, and today we are joined by Dr. Robb Leigh, who serves as the Chief Medical Officer for ACOS, a telemedicine platform. Telemedicine has been around for some time, perhaps a couple of decades. Although it is still seen and viewed as a novelty by many, it is impacting healthcare in positive ways by providing better access to care, especially for patients in remote areas who have no means of seeing providers. Do you have a telemedicine platform? Members of the Southern Medical Association receive a 10% member discount on ACOS Connect, which is our telemedicine platform for strictly SMA members. Please visit sma.org/telemedicine for more details. Thank you, Dr. Leigh, for joining us today. If you don't mind, give us a quick summary of your background for our listeners and also some context about who ACOS is as a company.
Yes. So I have practiced emergency medicine for about 15 years, then worked for a medical assistance company that delivered care via telemedicine for a number of years. Then I joined ACOS 4 years ago when the company was starting. ACOS offered services of a virtual urgent care clinic and saw patients who would normally go to an urgent care center for a relatively minor condition. We then grew and expanded our services to include AI-powered medical clinics to serve as extensions to telemedicine practice. Although you didn't ask, the name ACOS means remedies in Greek.
Oh, that's really cool. I really appreciate you throwing that in there because of my love for Greek history and things like that. So I didn't even think to put those two together when I heard the name. So can you go into how telemedicine has become an important topic to talk about in today's time?
Yes, telemedicine has been around for some time, perhaps a few decades, although it is still viewed by many as a novelty. It began as a way to address lack of access to care, especially for patients in remote areas who had no means of seeing medical specialists. So primary care providers would bring their patients to their offices and video conference with a specialist, for instance, a cardiologist, who would then provide their expert opinion on how to manage the patient's heart condition. Its role gradually expanded and telemedicine became available to patients with relatively minor conditions, such as a sinus infection, to people living in urban and suburban areas. So instead of going to the doctor's office, an urgent care center, or an ER, they would simply begin a video call and talk to a healthcare provider for less and without having to go to the doctor and all the hassle associated with it. The concept was very enticing, but adoption was slow as users and providers alike were not too familiar with the new technology. However, millennials quickly embraced telemedicine as it felt natural to them. Then the COVID-19 pandemic changed everything. Social distancing became the law of the land, so to speak, to help control the spread of the pandemic. People realized that waiting rooms of doctors' offices, urgent care centers, or ERs were germ breeding grounds, so best to be avoided, and fear of catching the coronavirus became a constant worry to many. Almost instantly, telemedicine became a household name and everybody was talking about it. The biggest selling point was that telemedicine brought the risk of catching the coronavirus down to zero, which was obvious to everyone. Therefore, no further explanation or convincing was necessary. Patients saw that telemedicine allowed them to see their doctors and have their needs met with absolutely no risk of catching the COVID-19. You know, not many mitigation measures bring any kind of risk down to zero. And since most people are already comfortable with video conferencing through popular apps such as FaceTime, Skype, and similar, seeing their doctor via telemedicine wasn't a big deal. And telemedicine has three major selling points. Number one, it improves access to care as doctors don't mind nearly as much seeing patients during their downtime from their home office, for instance, as it usually takes about 10 to 15 minutes of their time to see a patient, and they can go right back to relaxing activities, and they don't even need to wash their hands afterwards. Number two, it lowers healthcare costs because it's cheaper to see a doctor via telemedicine due to a much lower overhead. And number three, which we just briefly touched, it brings the risk of disease transmission between patients and healthcare providers down to zero. This is a novelty factor now, but it will remain a concern going forward. And let's not forget, this is a cool way to see the doctor.
So yes, I can agree more. I think telemedicine is a really cool way to see your doctor. I am a millennial myself, and I'm one of those ones. I don't necessarily like talking to people in general. So, or going talking to someone face to face. So if I could do it over the phone without even having to leave my house, I'm all for it. So I completely understand that. So with talking about how telemedicine has really been implemented, especially over the last couple months due to the COVID-19 pandemic, what are some of the major barriers that physicians or healthcare workers have with the implementation of telemedicine?
I think the biggest challenge with telemedicine was that people saw its limitations, not its virtues. Yes, limitations do exist, and patients with serious conditions or anyone who requires a procedure, for example, a cut that needs stitching, need to be seen in person by a healthcare provider. New patients with complex conditions looking to establish care need to be seen in person. Annual physicals are also preferably done in person. On the other hand, telemedicine is ideal for relatively minor conditions not requiring a procedure or for chronic stable conditions requiring regular checks, including visits for medication refills, as it saves substantial amount of time for patients since the doctor comes to them and not the other way around. The convenience factor is second to none, especially for those with tight schedules or with transportation issues, and now includes those who are germophobes. And there are quite a few of these are among us. Someone coined the term website manner, referring to a few things telemedicine providers need to be acutely aware of. Um, Similar to the bedside manner often mentioned regarding healthcare providers. So during a video conferencing session, because patients see our face and perhaps the neck and shoulders only, our facial expression, tone of voice, and gestures become magnified. So we need to be aware of those facts. We need to show empathy without exaggerated expressions or voice inflections. So it's important that we don't try to exaggerate, but to portray the situation as natural as possible. And we also need to appear as professional as possible, including our grooming, hair, face, outfit, amount of makeup, ornament, etc.
And let me tell you, I do not think I could be a doctor myself with telemedicine because I'm one of those people that whatever I'm thinking in my head, it shows on my face. My voice, the inflection of my voice will raise, and I can't hide it on my face. So I could not do that without giving away what I really am thinking about it. Yeah. Going back to about how you dress, working from home has made me spoiled because like, you don't have I don't have to get really dressed up in to work from home. But when I have that conference call, I understand I gotta put on a nice shirt, make sure my hair is combed, make sure I look decent enough for the camera. So I understand that as well. So
hmm
what do you think are the real barriers that people need to be aware of with dealing with telemedicine?
Oh, yeah, that's a great question. So there are a few barriers that we are gradually overcoming. I think one of the biggest ones is adoption by users. So you mentioned that you, being a millennial, you feel very comfortable in front of a telecommunication a device with technology in general. Um, and the adoption by users has increased dramatically with the COVID-19 pandemic, but it still has a long ways to go. Then reimbursement used to be a big barrier. Um, However, Medicare laxed its rules very recently, whereas in the past it only used to cover telemedicine for rural population. Now, with the public health emergency declaration, it covers telemedicine in many common settings. And whenever Medicare adopts a measure, most insurance companies follow suit. So reimbursement has improved significantly. Then next would be the availability of internet. This is still an issue in certain areas of the country and our state, but something that's also gradually improving. Um, and the last one would be the user's comfort level with technology. And obviously, like we mentioned, a young generation is extremely savvy and comfortable with technology. However, Medicare beneficiaries are mostly senior patients, and people with health issues tend to be older. And these people are not necessarily comfortable with all aspects of technology because they did not grow up with the technology. However, a lot of them have young family members or friends who can help them if they need. So I think the barriers are there, but they're gradually being overcome.
Do you think with the pandemic that it has actually had to make people have to give in and learn new technology? Because I know a lot of like my older relatives and everything like that, they're not, used to having to use technology and understand it because they're just like, I don't want to and I don't have to, but now they're kind of having to be forced. Do you think that's
Uh,
what you're seeing a lot of?
yes, that's exactly what appears to be happening. Um, in the past, many senior citizens, patients, happy using their phones, FaceTiming with their younger relatives, like grandchildren or children. Now they are forced to use the technology for certain things, especially healthcare. So um, faced with using the technology or just completely not being able to access care, they are forced to this situation, and they're finding out that it's actually not that bad. And once they get the technology up and going, they're able to see their doctor, and it's not really that much different than talking to a family member via smart devices. So they're getting they're gradually acquiring the comfort level that's necessary.
Yeah, I agree. I agree with that. I have a grandmother who, bless her, she just technology is not her thing at all, and I'm at least called once every couple of weeks to come fix some kind of technology problem for her that she has
Hmm.
somehow done, whether it's an iPad to the internet or even connecting her printer up. So I
Oh,
understand
I
that.
see. Hmm.
And speaking of the barriers, one thing I want to ask is telemedicine possible in areas without the internet, such as like, southern rural cities or anything like that? How does that affect it?
Yeah, that's a great question. The cell companies, the cell towers are they give out the signal, and obviously the closer you are to a cell tower, the stronger the signal you have on your device. And the LTE network has shown that it provides enough bandwidth to allow for basic video conferencing. And we had several instances of patients connecting to us without the internet, but with the LTE coverage. Although the coverage isn't 100% reliable, so it may go in and out. And then we had instances of video images disappearing, but the voice is still there, and then a few seconds later, video comes back. So it is possible, not ideal.
Awesome. Great. Thank you for that.
Mhm.
So, going on to the next question, do telemedicine service providers typically provide the level of education and training to properly implement and manage a service like this within a practice? Is it hard for them to get into it, or is it pretty simple and straightforward that they can implement it right away?
It is very straightforward, although we, as a telemedicine provider, we have a training module that we offer to our providers and practices who start using our platform. But a lot of this is common sense, and we need to be cognizant that things are magnified, like we mentioned earlier, and we tend to record most of the interactions unless the patient requests not to be recorded. So as long as we are cognizant of the fact that well, we could be under scrutiny, we're okay. And I believe other telemedicine companies also provide some education and reminders along those lines.
Before we wrap things up, is there anything you would like to bring attention to on the topic of telemedicine?
Let me just touch the quality aspect of healthcare provided via telemedicine. And I think as long as we hold both patients and healthcare providers accountable for their part, I think the quality is comparable to regular in-person visits. Patients need to be compliant with the care plan and follow the healthy habits, including healthy diet, regular exercises, and follow their doctor's recommendations in full, not selectively. And healthcare providers also need to see each patient as individuals and tailor care plans to specifically address that patient's health issues and not use the cookbook approach and deliver care with the help of a team of allied healthcare professionals to address all health-related issues, which are usually closely related to achieve the best outcome.
Before we wrap all this up, Dr. Leigh, I want to ask one last question. And with everything going on with the pandemic and everything, how do you see the future of telemedicine shaping up to be?
Telemedicine has arrived. It has become a familiar technology to many, including the senior population, which is the great majority of Medicare beneficiaries. Although it has temporarily replaced most office visits for stable, relatively minor conditions that do not require procedure, and visits for chronic and stable conditions, including medication refills, It is carving its niche and will eventually have a permanent role in the healthcare delivery arena, complementing the existing avenues such as doctors' offices, urgent care centers, or emergency rooms.
I know, like you said earlier in the podcast, like anything serious, surgery, stitching, obviously you're going to have to go to a hospital and see someone in person. There's not going to be any way around that. Do you think telemedicine, in a way, can effectively replace like smaller doctor's offices where they don't, they're not in specialty or anything like that? They're just your basic primary care physician. Do you think it'll replace that and eventually become to where all primary care physicians are going to be a telemedicine service without being an in-person?
That's a very interesting question. Um, in theory, that is possible because, like I mentioned earlier, most primary care visits are um, on stable patients and to manage their chronic conditions. And although physicians listen to their heart, sounds, lungs, and do a brief exam has become less critical in diagnosing and coming with a treatment plan nowadays. So in theory, that is possible. Now, in practice, I think that would be hard thing to occur because a lot of people still like the personal touch and and uh, the uh, the fact that doctor is right there in front of you. It's a real person who's talking to you and trying to help you. So I think for that reason, it may be it may not completely replace primary care practices.
Okay. Just wanted to ask, it's something that just popped in my head thinking,
Hmm.
with how the world is constantly moving towards more technology and then,
Hmm.
more away from the in-person. So,
Yes.
Dr. Leigh, I really appreciate you joining us today and talking about this important topic. And I would love to possibly maybe a couple months down the road, once we see the ramifications of COVID-19 and everything like that, and how telemedicine has really been affected.
Sounds good, Dylan. Thank you very much for having me, and that'll be a pleasure to follow up on the conversation.
Please consider supporting our mission by becoming an SMA member or making a tax-deductible donation. You can do this by visiting sma.org/donate.